started today?
Yeah.
I just want to get this off my hands.
All right, Tamika, hands. When should they be washed?
According to the CDC, hand washing is required, using soap and water, of course, before eating, after using the restroom, and if hands become soiled with blood or bodily fluid or visibly dirty.
Good. Now, Paula, what's the right way to start washing your hands before you even turn on the water?
Well, definitely make sure you've removed any jewelry and always keep your clothes away from the sink.
Good, and why is that?
Well, to prevent contamination of your clothes. And also, jewelry can harbor microorganisms and contaminants.
Exactly. Robert, why don't you go ahead and turn on the water and be careful about the force of the stream so you don't splash your clothes.
Okay.
What's the proper water temperature?
Well, the water should be warm to the touch.
That's right. Okay, you're going to want to wash your hands, keeping your fingertips below your elbows because you want the water to run down towards your fingertips, all right? Now, we have a soap dispenser here, but you may find yourself in a situation where there's a bar of soap. So, what's the difference?
Well, with a bar of soap, you want to wash the soap before using it, and then wash it before returning it to the soap stand.
Good. It's important to get good friction going to loosen the dirt that can get into the skin crevices. Make sure you wash up to an inch above any visible dirt or an inch above the wrists. Take care to wash your palms, back of the hands, fingers, and the areas between the wrists, knuckles, and forearms.
Like this? I should use a firm circular motion, right?
Yes. Now use your fingernails of the opposite hand to clean under the other fingernails. How long should you wash your hands?
At least 15 seconds.
Yes, at least 15 seconds. Okay, Robert, you're going to want to rinse your hands thoroughly now. Keep your hands below the level of your elbows to avoid contaminating forearms or elbows. And once you're done, you're going to want to leave the water running while you get a paper towel or two. And why is that?
Well, you always have to consider that the sink itself is contaminated.
Exactly. So take the paper towels and begin to dry your hands, starting at the fingertips and working your way up the forearms. Then you're going to want to use another paper towel to actually turn off the sink.
Miss Swenson, is it all right if I use moisturizer? In the winter, my hands get really chapped.
Moisturizing lotions are fine as long as they're oil-free.
Well, if a sink isn't available, could you use one of those alcohol-based antiseptic solutions?
If your hands are not visibly soiled or contaminated with body fluid, then you do have the option of using an antiseptic hand rub. Can anyone tell us what we should keep in mind when using these solutions?
Yeah, there are different decontamination requirements at each institution, and we should be aware of the product label and instructions for the antiseptic hand rub.
Right. Okay, Tamika, how do we go about applying antiseptic hand rub?
Okay.
All yours.
First, I apply the recommended amount of product into the palm of my hand, then rub the lotion into my hands with a circular motion, making sure to get into the same crevices that I would when washing my hands. I continue rubbing until the product is evaporated on my hands.
Excellent. Well, why don't we all clean our hands, and then we'll take a look at some of the interventions that halt the spread of microorganisms and minimize the threat of infection. Okay?
Great.
All right.
Okay. Now, several of your patients today have treatments that require using sterile technique. So let's review some of those skills.
Will we be setting up a sterile field?
Yes. And we'll also review how to put on sterile gloves and personal protective equipment. So first, let's review the guidelines related to sterile technique and sterile gloving. What can come in contact with sterilized items? Robert?
Well, only sterilized items can come in contact with other sterilized items, like sterile gloved hands.
Speaking of gloved hands, when would you replace your sterile gloves, Paula?
Well, if your gloves develop an opening or a tear, or if there's a compromise in the integrity of the material.
When else?
If your hands touch any unsterile surfaces or other items.
And?
Oh, right. If your hands go below your waist, that's also considered contaminated.
Good. What's the easiest way to compromise a sterile field?
And by turning your back on it or not keeping it above waist level.
Exactly. And remember, never reach over a sterile field. Okay, Paula and Tamika, I'll catch up with you guys later. I'm going to hang out with Robert and find out about his next patient, all right?
Okay.
Good luck. Robert, tell me a little bit about your patient.
Well, I'm going to be taking care of a patient who has a surgical incision that is separated and opened. Her physician has ordered dressing changes twice a day.
All right, well, why don't you gather your supplies, greet the patient, take off the old dressing, and I'll meet you in there in a few minutes.
Sounds good.
All right.
See you later.